Bryce from ELDOA USA. Do you have sciatic pain or work with somebody that does? Unfortunately, my wife is having a little bit of sciatic pain right now. We're gonna go through some of our go-tos in treating in regards to exercise and things to do and things to potentially not do, which I think is something to think about in regards to how you're utilizing ELDOAs. So we're gonna talk to you about how to treat sciatic pain. Here's my lovely wife, Annika. She's having a little bit of sciatic pain. Right side? Right side. She usually has a little bit of right side stuff, a little bit of SI joint stuff. You know, obviously I'll treat her from time to time. She has some protocols in regards to doing some ELDOAs and different stretches, but we're gonna do our go-to stretches. And we're gonna give you a couple commonalities that people do regularly to kind of treat some of these things and what our focus is in regards to trying to create essentially space for the nerve. So a lot of times what people look at with the sciatic nerve is that sciatic nerve is going through that glute. The real symptoms of sciatic pain are that sciatic nerve is giving you some sort of symptoms down your leg, potentially all the way down into the foot and the toes. So sometimes when it's just isolated into the glute, it could be sciatic, it could be the gluteal nerve, it could be the piriformis being tight. So a lot of times people will try to stretch that glute complex or that piriformis area to try to mobilize the sciatic nerve to make sure that it's not getting impinged. Now, if we back up a little bit, the sciatic nerve is arising from several levels of the lumbar spine and the sacrum. So from L4 down to about S3, all of the nerves that are exiting out of those structures are all reconfiguring back together to create essentially one nerve, but one nerve is really a bundle of many thousands of nerves that are starting to go down the leg to innervate different things. So our goal when the sciatic nerve all comes back together is that it has freedom to move in the soft tissue, which really is the fascial tissue around the glute or around the piriformis area as it exits out of the pelvis and down into the lower leg. So we also want to consider how it might be impinged along the spine. So we're going to do a couple myofascial stretches first. We're going to show you some commonalities of stretches that people do that I use sometimes in my practice because they're easy for people to do on their own at home. And then we're going to look at what to do and what not to do with some ELDOA work. Okay. So what we're going to do first, a lot of times people know the stretch called pigeon pose. Pigeon pose. A lot of times they do that in yoga. It's a stretch that is a lot of times taught as a piriformis stretch or a glute stretch. So let's go ahead and do a pigeon pose and just kind of show what that posture looks like. So we're getting into that high position with the leg. Now we can kind of increase this stretch however we want. So the knee right now is towards the middle of the chest. And depending on the flexibility of the hip or the glute or the tissue around the hip and the pelvis, it depends on what position you can get yourself into. So what we can usually do is the hip is right now to the floor or the femur is to the floor, and then she's kind of rolling over the top of it to try to increase that stretch. We always want to consider the posture of the spine to make sure that we're not too rounded or we're not too extended. The other leg is just straight back, and we're allowing our body weight to just fold over on top of that leg, resting on the forearms. Now, if I want to increase this stretch and I want to increase essentially external rotation of the hip, she can now come up on her hands and now move your foot up so that the shin is more parallel with the top of the mat. There we go. Now that's going to increase tension in and around the hip, especially on the back side in this forward leaning position. You feel more tension there?
Yeah.
So try to lean a little bit forward if you can. Now, if getting into a pigeon pose position is not user friendly for you, getting down on the ground, especially if you don't have good mobility or you've got other considerations for how you're moving your body, you can do this on top of a table, a counter, a high bed, and you can lean over on that leg by having that leg resting up on top of that area. And so again, we're trying to concentrate on this stretching and lengthening through the spine. I always like the lengthening part of, you know, this stretch. So go ahead and relax that. Let's go ahead and lay on your back. So not too dissimilar from the leg position for the stretch. She's going to go ahead and cross her right ankle to her left knee. And we want to make sure that the ankle's to the outside of the knee. This is our typical glute stretch. So this is glute max deep. The glute max deep is in link with the fascia around the piriformis or in that deep glute area. So she's going to go ahead and take both hands to the thigh. She's gonna pull that thigh towards her. As she pulls the thigh towards her, we wanna add our little fascial considerations with eversion of the foot. Her spine is flat. She's in a little elongated position. Again, if you're more tight and you have a hard time keeping your shoulders and your head on the ground, try to put a pillow or something underneath you so that you stay fixed to the floor. With this same side elbow, we're gonna press that forearm into this thigh to make sure that we can kind of turn that knee away to increase that stretch. So if you look at this posture with the leg turned in front of her, it's very much like being in the ground position. We're gonna press the sacrum or the back of the pelvis into the floor. She's keeping her pelvis level, she's breathing, she's elongating, and she's increasing the stretch. Any of these types of stretches can be done typically for around 30 seconds. You can hold longer, 45 to 60 seconds. It just depends on how you kind of coordinate yourself to get into the tension of the stretch. Usually much more beyond that isn't necessarily beneficial, as it's better to get several rounds of the stretch in and try to increase the intensity every single time. So that's our glute max stretch. Go ahead and relax that. So now the next thing that I like to do is we're gonna actually work with the piriformis. So go ahead and prop yourself up on your elbows. I like getting in this position unless you have a big shoulder pathology or some sort of issue with your shoulder girdle. But I like getting into this position to start because it's easier for the hip to get into rotation. And so what we're gonna do is she's level with her pelvis. The sacrum or the back of the pelvis is trying to stay down towards the ground. She's gonna step her foot out wide. Go ahead and let your toes come up and you're on your heel. Yep. And then she's gonna let that leg just drop down and in to the point where both legs are about parallel with each other. So if you need to adjust the foot position to try to have that parallel position, no problem. If we've got a little bit of discomfort on this knee on the inside because we're pressing down here, then we can always bend the knee a little bit more, and that takes some of the pressure off of that knee, and it also changes the lever arm of rotation, so it allows her to keep her pelvis a little bit more level and to try to bring that knee down and in so that she can get essentially internal rotation of this hip to now stretch that piriformis coming through the backside of the hip where the piriformis is in the sciatic nerve. So she can elongate, keep that tuck position of the pelvis, press that sacrum down into the floor and try to work to bring that knee down and in, and she can even activate and push that knee away from her pelvis to try to increase some of that tension along the backside of the hip. Again, around 30 seconds, 60 seconds, however long it takes to kind of get into a working position of the posture and allow that tissue to start elongating in this active position. So then go ahead and slowly relax that. How did that feel? Tight?
Yeah, very tight.
Yeah. So the reason I have her in this lying position is it allows her hip to move in a better posture, as opposed to if she sat all the way up. Some people have a capacity to do a lot of internal rotation. So sitting up, it closes the hip angle, and especially for women in this posture, the pelvis is wider. And if we go into internal rotation, sometimes that creates just a normal impingement position because the femur is moving inward towards the midline of the body, and you can run into the pelvis and it can be a little bit uncomfortable for the front of the hip here. So sometimes this is a more difficult posture when you're more upright to get into this position. So I prefer to start more on the elbows. Those are some basic stretches that I like to do to try to mobilize some of the tissue on the backside of the glute area or the backside of the hip to try to free the sciatic nerve. Next, we're gonna move into a couple ELDOAs. So we're gonna move into the ELDOA portion of this. Remember what I said before is that the sciatic nerves comes from the lumbar spine and the pelvis or the sacral area. So L4 down to S3. Now, working the ELDOAs in the sacral area are a little bit more specific and take a little bit more awareness in your body to try to work with those. So we're gonna kind of put those in our back pocket. They're definitely ELDOAs that I like to work with because it helps to really kind of not only mobilize the fascia around the sacrum, but it has a lot of carryover into some of the viscera that might be in the pelvic area that you need to try to treat. And it helps to try to increase that micro flexibility of the sacrum, because sometimes when things get really rigid and tight or the tissue around particular areas like the pelvis get really tight, it not only compresses some of the joints, which creates a immobilization of some of the joints and the pelvic movements, but it also, if the tissue around those areas get really tight, now you have less fluidity, and that decrease of fluidity around that area can affect not only the nerves, the vessels, but again, where the organs attach around the pelvis. So those are a little bit more specific and probably beyond the scope of this video. So what we're gonna do is, a lot of times people talk about using L5-S1 as a way to treat sciatic pain because you're working at L5-S1, which is one of the main areas of the lumbar spine where the sciatic nerve comes out of. The problem with L5-S1 is if somebody's got a real case of sciatic pain, they have usually a lot of nerve tension, and to straighten the leg out and try to elongate in that leg creates a lot of pain. And I know that Annika, even though she tries to do L5-S1 weekly, if not throughout the week, that putting her leg straight up the wall and trying to really elongate through that position can be a bit painful, right? And the nerves don't like to be stretched because stretching the nerve compresses the nerve, and that can cause a lot more pain. So what we're gonna do is we're gonna do L4-5 ELDOA, so L4, L5 ELDOA, which is again one of the main areas of the sciatic nerve where it comes out of the spine. So why don't you go ahead and face them that way, and just seated on your sit bones.
Yep.
And she's gonna have the knees about 90 degrees and go ahead and let them fall out to the side. The heels are gonna be about 2 hand widths apart, or about the width of her sit bones. She's gonna be an E version of the feet. Now, mobility is always a question when setting somebody up in this position, because we want to try to have the spine as straight as we can. Now, if she doesn't have a lot of mobility in her hips, we might have to move her feet a little bit forward so that she can sit up on top of those sit bones and keep that lumbar spine from rounding or flexing. If she's even that much more tight, there might be a need to put a couple blocks underneath her or a step underneath her to elevate her from the ground, so that again, she doesn't have that rounded posture of her lumbar spine. She's got some mobility. We want to maximize this mobility. So for her, we're actually going to move the feet just a little bit back so that she's in a nice lower spine posture, and we've maximized this tension so that we can fix below the area that we want to try to open. The knees are going to try to press down towards the floor. She's going to breathe and maintain axial extension to elongate her spine up. I want her to really focus on that breath to lengthen. So inhaling expands the body, or expands the posture in the spine. And then as she breathes out, instead of letting everything kind of relax and compress back down, she's going to maintain that active posture like she's pressing the crown of the head towards the ceiling. Now at home, if you don't have anybody watching to see where the posture of your spine is, you can use a wall as a guide to make sure that you keep yourself straight up and down the whole time you're doing the ELDOA. So she's going to keep pressing those knees down. She's going to keep breathing the spine up nice and tall away from the pelvis. And I want her, and we can progress this. We can either reach forward and then go up, or we can just reach right up into the posture. So go ahead and go right up and push those arms to the ceiling. Our goal is to have symmetry of both of the arms so that they're parallel and reaching up above the body. If we have limitations, again, in mobility for the shoulders, the arms can be a little bit forward of the body, but we want to maintain that spine in an upright position. She's going to continue to breathe and lengthen. We want to make sure that she stays nice and straight. The knees continue to press down. The chin is in, the eyes are looking down, and she's really, again, breathing into that lower spine to lift and lengthen the spine up away from the pelvis. Her goal is to hold this for about 60 seconds. When she's done, she can relax the arms back down and go ahead and take the hands to the knees. And then usually I like to do a little bit of spinal rolling here, where she's going to tuck the tail, pushing the spine back, and just coming forward and back in this position, almost like a seated cat-cow. And that is going to be our main components for treating somebody with sciatic. There's obviously a lot of other considerations, looking at SI joint, looking at hip flexors, looking at just overall posture and function of the soft tissue and the other joints and structures that are around this area, to make sure that everything is free and we have the proper slide and glide and the space of the body. But I think just the easy stuff for people to do at home that you guys might be able to do or be able to program with your clients is to be able to look at just some of those simple exercises and start with that. And then if you have to start working a little bit more specifically, you can start peeling back the layers and start improving sciatic discomfort.